My name is Chris DeMella. I am a graduate of the VCU School of Pharmacy, class of 2014, and I am the critical care pharmacy specialist at Johnston Willis Hospital. As a kid, I wasn't really sure of what I wanted to do. I either wanted to be a professional baseball player or a rock star. And I always assumed that my career would kind of choose me, that as I got closer to college, I would figure out what I wanted to do. I had always been fascinated with the human body and life in general, and classes like anatomy and biochemistry really drew me in. So at that time, I had a pretty good idea of what a pharmacist did. You know, everyone has been into a CVS or Walgreens and seen them behind the counter in the white coat. My dad also worked as a pharmacist, although he worked in a hospital, and I wasn't quite as familiar with what his role was. And at that time, I decided I wanted to explore that career option. So I went ahead and sought out employment at a pharmacy. And upon starting at that pharmacy, I really enjoyed the patient interaction. It was a very fulfilling job to have at that time. So after experiencing working in a pharmacy, it pretty much cemented my decision to apply for pharmacy school. And having already had a job at a community pharmacy, I assumed that I would stay on that track, graduate, and take on a career in community pharmacy. It wasn't until I got to school when I realized that there were such things as clinical pharmacists who actually worked on the medical teams, worked closely with doctors and nurses, and I had some professors at VCU speak to me individually and recommend pursuing a clinical path. VCU also offers programs for physicians, dentists, nurses, and physical therapists. So even as a student, you're being exposed to that interdisciplinary healthcare model, which we've really moved towards over the past decade or two. Not only does that help you as a student become more aware of the different roles of other providers, but it also helps build that camaraderie so that when you do enter the medical field, you are comfortable with working with people from different backgrounds and different expertise, and you realize the value that they can bring to the medical team just from having a different perspective on healthcare. Even in my job today, we have multidisciplinary rounds every day. So the healthcare team is made up of, usually it's led by a doctor. They may have a mid-level practitioner, such as a nurse practitioner or physician's assistant, the nurses, the pharmacists, the physical therapists, the social workers, the dietitians, the case managers. They all come together and discuss what the best course of action is for each patient. So my role, in a nutshell, is to optimize the medication regimen for each one of my patients in the intensive care unit and the neuroscience intensive care unit. The ICU setting can be a little bit hectic. You're dealing with very sick patients who can be unstable and can crash at any moment, and it's not uncommon for emotions to run high in that setting and for problems to arise that need solving on the fly. I really enjoy having to think quickly on my feet and coming to solutions that are best for the patient. And whether it be something like the patient doesn't have enough IV access and we have to figure out how to best administer these medications or time out the administration in a way that's best for the patient, or choosing the optimal agent for sedation or something to maintain their blood pressure while reducing any side effects that they may experience. The ultimate goal for me is to make sure that each patient under my umbrella is being treated as optimally as they can be.